Hey everyone, Dr. Avind Philomin here. I'm a general dentist and a board-certified implantologist from beautiful New York City. New York is a very big city with over 10,000 dentists to choose from. If you or anyone you know are missing teeth, here are top 5 questions you want to ask your dentist before committing to implant surgery. This will help you determine the credibility of the doctor in a very short amount of time. Let's begin. Question number 1. What is the provider's formal education with regard to dental implants? Who were they trained by? What form of education or training did they receive? How long did the training last? These are questions related to the dental professionals' schooling on implants. They are very important. For example, I have done multiple CE courses, in my case over thousands of hours. I have studied under various board-certified implantologists and surgeons and learned how to place implants and how to restore them. I have devoted hundreds of hours taking notes and learning every complication and how to take care of them when the complication does occur. I have also apprenticed under various oral surgeons and periodontists to understand how implants do work. Question 2. Does the dentist have a 3D CT scan? So this is something patients don't understand. There is a significant difference between a traditional two-dimensional X-ray that they take during a cleaning and a 3D CT scan. As I said, the X-ray is a two-dimensional image. When placing implants, the X-rays can just tell me the distance between two tooth roots and maybe the height of bone I have available. But it does not give me a lot of data that I need when it comes to the anatomical structures around there, the depth of bone, the thickness of bone, and many other important details that allows me to place an ideal implant in the ideal location. The 3D CT scan on the other end gives me the complete bone layout in a three-dimensional view. With this, I'm able to see the thickness, the height, the length, important anatomical factors, and also I'm able to gauge the quality of bone, which I could never tell looking at a traditional X-ray. Furthermore, I can use the 3D CT scan to print 3D guides. So it's kind of important to find out if your dentist is using a 3D CT scan or not. Question number 3. Will the dental implant and crown be placed in the same office? So in many general dentist offices, there will be a separate dental implant process between two dentists. One dentist will be the dental surgeon who will place the implant into the jawbone, and the other dentist is responsible for placing the crown on top of the implant that was placed by the surgeon. I've seen some weird cases in the past where one doctor placed the dental implant, the patient went to a different office, and the crown was restored there. At the end, what you get is a weird looking dental crown. It has food trap and constant annoyance as you have to keep it clean all the time. So patient didn't like how the crown looked because the doctors failed to collaborate effectively. So I would recommend trying to work with a dental implant provider who actually works in very close collaboration with a surgeon or the dentist who can place and restore the implant himself. Question 4. How will the dentist take into account your specific medical condition? So the success of any surgery, just not implants, it depends totally on how the surgeon takes into account your medical condition. For example, people with diabetes will have a much harder time healing after the dental implant process. So we need to take some extra precautions to make sure these implants are successful. Question number 5. How accessible is the surgeon after your procedure? This is an absolute must. The fact of the matter is there is a small chance something unexpected might happen, like a stitch falls off. The implant provider may have done nothing wrong, everything perfectly to the T, but some reason the stitch came off. And now you're freaking out thinking the implant's going to fall out of your mouth or get infected. What do? Can you call the surgeon and can it get taken care of? You should have your surgeon's word that he will prioritize you if something wrong occurs. I also want to add a side note here. There is one of the reasons why I get concerned when I hear people getting implants done in another country. If something wrong happens after they come back to the United States, they're going to have some serious logistical issues. Anyway, this concludes the content for this video. Those are the top 5 questions you want to ask your implant provider before committing to dental surgery. If you found value in this video, please go ahead and give us a thumbs up or share it with friends and family. This is Dr. Avind Philomin signing off for Esthetix Dental Spa in New York City.